I'm sorry I'm unable to be with you today at the Weave conference in Wrexham. I thoroughly enjoyed the previous conference 2 years ago in Newport, which was extremely successful, and I'm sure it will be the same again this time. I'm Nesta Lloyd-Jones. I'm the Assistant Director at the Welsh NHS Confederation. The Welsh NHS Confederation is the membership body that represents all the organisations that make up the NHS in Wales. It means that we work very closely with the chairs and chief executives and other leaders across the NHS to ensure that there is a clear and consistent voice for the Welsh NHS. We are uniquely placed to work at a national level with our members, but also importantly with partners to try and address the current challenges for the health and care system, and also to shape the future of the health and wellbeing system in Wales. We communicate with a range of stakeholders to drive for a better health and healthcare, and also to support population wellbeing. As an organisation, we have recognised the importance that the wider determinants of health, including culture and the arts, has on people's health and well-being. And this is why we work strategically at a national level with the Arts Council of Wales and also with Gwehyddu for many years. Wales has led the way in developing arts and health initiatives, which enhances the lives of the most vulnerable in our society and keeping people healthy and close to their communities. And we all should be very proud of this partnership working and the work that we've done to date. Since September 2017, the Welsh NHS Confederation has had a partnership with the Arts Council of Wales. It's aimed to establish a more integrated approach to arts and health, and both organisations share the same core objective: to improve population health outcomes and promote general health and well-being. There has been a growing understanding of the positive impact that taking part in the arts can have on people's health and also well-being, and especially people's mental health. Access to the arts opportunities and participation in the arts can dramatically improve health outcomes and well-being, counter inequalities, and also increase social engagement. While there has been an increase in awareness and more partnership working across the health and the arts sector, we know that the coming years will be crucial for both sectors, with significant challenges facing the health and care system and also the arts and culture sector. Ahead of the Senedd election in May 2026, a key priority for us at the Welsh NHS Confederation will be raising awareness and understanding with politicians of the challenges facing the health and care system and the significant contribution all sectors, including the arts, has on people's well-being. There is currently a burning platform that will pose an ever-increasing challenge in delivering high-quality and safe services. The proportion of people aged over 80 will be doubled from 2000 to 2038. The number of people living with long-term conditions will double in the next 15 years. To respond to these demographic challenges, we believe it is imperative that there is a fundamental shift in the health and social care system over the next decade. At its heart, this is about moving from a reactive model, treating people when they're unwell, to a more proactive one, focusing on prevention and early intervention. This will require working across all sectors to support people to be active participants in their own health and well-being and creating more resilient communities. We must consider the wider determinants of health, such as housing, education, the economy, transport, and access to arts and leisure, all of which are building blocks for our health and well-being. Health is not an island, and it will require the next Welsh Government and all Welsh Government departments and sectors to work together rather than in silos to really initiate change. That is why, at the Welsh NHS Confederation, we are calling on the next Welsh Government to prioritise prevention and deliver a cross-governmental national strategy to improve health and well-being and also to reduce inequalities. This will shift the focus from treating illness to promoting health and well-being. Our vision is for all sectors to be working together to support and promote health and well-being. The arts has a significant role to play, and it will lead to a reduction in loneliness and social isolation, and a reduction in preventative diseases and health inequalities. What is clear due to the demographic challenges that we continue, like we always have, the health and social care system is unsustainable. There is a need for significant change from the next Welsh Government to shift us from an ill health service to a health and wellbeing service. As the body representing NHS leaders in Wales, we continue to be committed to raising awareness of the significant benefits arts and being creative can have on people's physical and mental health and well-being. And we look forward to working with the Arts Council, the Arts and Health coordinators, artists and key partners in the coming years ahead. So just a final word from me. Thank you very much for having me speak today virtually, and I hope that you enjoy the panel discussions and the rest of the conference. Thank you. Diolch yn fawr.